You know, just you can just adjust it. You know, a lot of people really struggle to start, and they kind of go, oh, it's actually a little better by the end of it.
Yeah, it starts off pretty.
Quite nice, like to feel exactly where the pain is.
Yep.
Sometimes it's just like my knees are just sore.
A lot of people get put off by the noise it makes at the start. So that's quite aggressive.
Yeah, the initial introduction to the sensation is generally odd, but then it actually starts to feel good. But yeah, we usually will start you slow and we'll build you up. We don't come in and whack you with the full pelt right away. We build it up. Is that you all done with it, Scott? Yeah.
Yep.
Perfect. So what I'm going to do now is I'm going to just mark off where I'm going to go. So we're going to find your joint line. So I'm going to just mark you up for that, Donna. So I'll do a wee bit of prodding about.
Okay.
Thanks, Scott.
So my next question is, Kathy, she uses this shockwave, doesn't she?
Yeah, take it in. She does, yeah. So I'm just going to dry that off while your blood's spinning away. So it's quite nice having us both there because it means that you can just kind of kill two birds with one stone.
Yeah.
This is just a surgical pen just to mark where we're going. Right. So I want you to just relax. Any pain or discomfort around the patella?
No.
Do you feel anything at all?
I think it's going a bit numb, to be honest.
After the shockwave? Yeah. Probably is. He's taking away some of the pain. It's moving all right. A wee bit of crepitus in there, Donna. Okay, there's your joint line there. There, and then we'll surgically prep all that up so all the bugs, because your skin's got lots of bugs in it. Not just yours, everybody's has. So what did you do your undergrad in then?
It's just biology, but and I went into molecular biology and did my honours.
And didn't want to get into that?
Nah, finished it and was like, nah, I don't want to do that.
It's funny, isn't it, how people do?
Medical sales.
Uh-huh.
And that took me back to, I was working on the class in the car rental department the whole time I was at uni. So they just gave me a job in car sales to give me experience to get into sales, and it never happened. I just ended up moving from Stirling to Steps, joined the gym, and the instructors were terrible, and I was like, I could do this good now, and that was it. Just did that South Mary.
So you went from wanting that...
I used to go to post charity teaching.
Uh-huh.
I went to 14 classes a week and attended.
You personally attended?
This instructor through Stirling. She was amazing, and she hired this hall, the miners' welfare hall, like a church hall. And I went to all 14 of her classes.
Good God.
And,
so she inspired you?
She was brilliant. So then I thought everybody was brilliant. And then I went to Valentine's, I was like, oh my God, like, they were terrible. So that's when I kind of got into Les Mills, because she didn't do any Les Mills, it was all freestyle stuff, she was brilliant. But,
is she still going?
I think so. I think she ended up hiring the rugby club to still.
You should tell her that she was your...
Oh no, she knows.
She knows, yeah, it's always good to...
Absolutely. But, so that's kind of how that happens. I never got into it.
You never did yours?
But it always helped me with everything, like helped me with...
Oh, your anatomy and physiology and all that, yeah.
And then same with beauty.
No problem. Do you want to lie back? Not Luke, are you okay? Right, so it'll just be a wee sharp scratch. It is quite a small gauge needle, right, but it does go right in, so it'll be a wee bit uncomfy. So if you just stay still, I think rather than not being able to drive for a few hours, that's no use to you getting a local anaesthetic. You chose not to bother with that. My hands are too. So I sometimes do question whether getting a local anaesthetic is really worth it, because you're just getting 2 jags.
It's not the jag, like that's not bothering me, it's the length of time it's in, maybe.
That'll
feel, what will I feel pressure?
Yes, you'll feel pressure. That's probably the weird. Yeah. I think local anaesthetic can be a wee bit sorer because it's more acidic. This is this same pH, whereas a local anaesthetic's a more acidic pH, so that's why it nips. So you won't get a nippy feeling, it'll just be pressure.
Right.
Look back. Sit back and think of Paris. Wee sharp scratch. Okay?
Mhm.
Pressure. Feel that?
Fine, yeah.
Doing well.
She is a machine. There you go. Done.
Good.
Done. Right, I'm not put all that in. Well done. Right, what I want you to do is take yourself to the edge of the bed. Okay? And I want you to swing your legs forwards and backwards.
Okay.
Okay? So we'll move this away.
Well, that one's still sore. Why is that?
Nippy, nippy. Well, sometimes if we kind of get quite close to a nerve, we might have kind of been near that. So if you sit there, and I want you to just sit up and basically just set yourself right back and literally just swing your legs. That's it. Swing them. Swing your legs. Yeah, I put more into that, so 5 mils into that,
And I think
3 into that one.
a bit more
Okay.
swollen already than the other
Yeah,
one.
it is. Okay, so let that just keep going, keep moving, and we'll get you some plasters. So as I said to you yesterday, I don't want you to rest. Okay, so do what your normal activities are. I know that sounds like, oh, normally after risk with getting this sort of injection really is the injection itself. It's your own blood, it's your own body's properties, Donna. So there's no, no, not at all. No, so you're not going to get that.
Yeah.
Sometimes you can get like a wee bit of pain after an injection, just like that injection pain. But again, with this sort of stuff, it's quite unusual. But just in case you do, don't overly worry about it. I want you to exercise as you normally would. I don't need you to rest. Actually, the more you move, the better. Okay. Now, in terms of when should you start to notice a noticeable difference? Well, most of the research will show 2 to 3 weeks after injection, you should start to notice a difference. Some people come in and say they felt it like right away the next day, but think about that kind of cellular action that we're trying to do, right? So it takes time for your body to get that. You're certainly going to be at least 10 days, right, for that healing properties of the, if you just think about, if you scratch your arm, it takes a good week to 10 days for that to fully heal. So think about that the same. So Scotland with the Shockwave done a little bit of micro damage, which is great because your body then goes, oh, there's damage here, let's start that healing cascade. And then we've then put your platelets in as well. So what we would generally recommend is kind of 4 to 6 weeks and 3 injections to really see a big benefit. All right. So that is you. You're good to leave the torture house.
That was all right. It's fine. Just a wee bit. Of course.
Yeah.